So the final NSAID in this list is Nefopam. For Nefopam, we must know that it is the only NSAID which does not inhibit COX enzyme. So it does not inhibit COX enzyme. Doesn't matter whether it is COX-1, COX-2, COX-3, it does not inhibit. So how does it act? It acts centrally. And it modulates pain pathways. Pain pathways centrally by inhibiting norepinephrine, epinephrine, and dopamine. So this is the main mechanism of action for Nefopam. Right, so Nefopam is usually given when we cannot give a person NSAID, because most of the NSAID will work on COX enzyme, and in certain situations when we don't want that, we can prescribe that person Nefopam. So the dosing tablets come in two formats, 30 mg and 60 mg. 60 mg one is rare, so we use 30 mg tablets every 8 hours, right? And 24 divided by 8, 24 by 8 comes out 3. We can give this 30 mg tablet 3 times. 30 mg tablet 3 times come out to be 90 mg per day. So max dose for Nefopam is 90 mg per day. Do not exceed this, because Nefopam has some certain different side effects than the other NSAIDs. Now let's see the mechanism of action and the side effects of Nefopam. Nefopam number 13. It is a very good analgesic. However, it does not act. It has no effect for fever. It has no effect for inflammation, and it also does not cause bleeding. So among all the NSAID, the celecoxib and etocoxib has the least one, and paracetamol and the Nefopam has none effect on gastric bleeding, right? So we can consider the Nefopam for pain, right? Now for side effects, so the Nefopam was having primarily the CNS side effects: hallucination, confusion, seizures. They can be even incidents of increased heart rate and such type of side effects, right? Now let's talk about the onset of action. Onset of action of Nefopam particularly varies very differently. It will range somewhere at about 20 minutes to about 45 minutes. Then the peak will be at 1 to 2 hours, and duration of action will be 4 to 6 hours. And there is no need to give any kind of PPI, because incidence of gastric bleeding is none. Similarly, for the paracetamol, we don't give any kind of PPI. So let's write it over here. No PPI required. No PPI required for paracetamol. And similarly for the Nefopam, no PPI required. Right, so we already discussed about all these two major things. Now let's talk about the indication of Nefopam. Indications of Nefopam, because Nefopam has a very good analgesic property, so it is usually given in moderate to severe pain. Majorly we give it for moderate pain, not for severe pain, because in severe pain we have other which can take part in very, very better pain control. Also we can use it for post-operative pain. Right, now let's talk about some other stuff about the Nefopam, which is the combination. Now because the Nefopam lacks certain properties, right? It does not have this antipyretic effect. It does not cover this anti-inflammatory effect. So we try to give the power to Nefopam by adding certain other drugs, Nefopam plus paracetamol, right? It will cover this antipyretic effect, right? Second is Nefopam plus tramadol. Now, because Nefopam was a good analgesic, but it was not a very, very great analgesic, right? Nefopam has like 3 opioids, so it is good, but not the greatest. Greatest was ketorolac, right? So in order to make a good option, we put a tramadol, which is a very, very good analgesic, to it, and likewise we also increase the dosage of Nefopam, so it makes the combination drugs much more safer. And last combination is Nefopam plus serotopeptidase. Serotopeptidase. Now, the serotopeptidase actually help Nefopam for having this anti-inflammatory effect. So that was all about the Nefopam, and we have already discussed about its combination. We have much better drugs than Nefopam, but there's only one main scenario in which we use this Nefopam, that when in certain situations when we cannot give the patient NSAID, because all the NSAIDs target this COX enzyme, right? Certain scenarios in the body which has some adverse reaction because of inhibiting this COX enzyme, right? In that certain situation, we can give the patient Nefopam. So this was all about the last NSAID that we needed to discuss, and after learning all these NSAIDs, you will be pretty much confident in giving somebody a particular type of NSAIDs, right? So before giving somebody NSAID, please do note what is the classification of this NSAID, how these NSAIDs work, what are these COX enzyme, are all those prostaglandins and everything, and right. And at the end, we prescribe a person NSAID, and depending upon the NSAID, we also prescribe this gas thing, which is not actually a gas thing, not only the PIs in very rural areas, right? Of the pharmacist consider it as a gas medication. It's not a gas medication, it is a medication to decrease the acid level in the body, to decrease the acid production in the body. We give PPIs, right? So in this lecture, we discussed about the different types of NSAIDs and the PPIs, right? I'll try to make another video in which I'll make a quick table, right? I'll list all the important NSAID and all the PPIs which can be given alongside with that NSAID. So yes, this was all about all the important type of NSAIDs, and yes, happy learning.